Hello everyone, and welcome to the first episode of Know Your Body. We're kicking things off with a bang, or should I say, a swing, by exploring the incredible world of your shoulder joint. This remarkable joint, the most flexible in your entire body, is your ticket to a world of movement. Think about all the amazing things your shoulders do every day. From throwing a ball to reaching for a high shelf, your shoulders are the unsung heroes of countless activities. They give you the freedom to move, lift, and interact with the world around you. But have you ever stopped to think about how this complex structure actually works? What makes this joint so mobile, and how can you keep it healthy and strong for years to come? Over the next few sections, we'll delve into the fascinating anatomy of your shoulder, uncover the secrets to its incredible range of motion, and equip you with practical tips and exercises to keep your shoulders in tip-top shape. Let's get started. Your shoulder isn't just one joint, it's a powerful team of bones, muscles, tendons, and ligaments working together in perfect harmony. Understanding how these structures interact is key to appreciating the complexity and vulnerability of this incredible joint. Let's break it down. First, we have the bones, the humerus, your upper arm bone, the scapula, your shoulder blade, and the clavicle, your collarbone. These bones form the framework of your shoulder, providing stability and support. Next, we have the muscles. The deltoid muscle, the muscle that gives your shoulder its rounded shape, is the powerhouse responsible for lifting your arm away from your body. The rotator cuff, a group of 4 smaller muscles, acts like a team of skilled mechanics, controlling the rotation and stability of your shoulder. And let's not forget the trapezius, a large muscle that extends from the base of your skull to the middle of your back, helping you shrug your shoulders and move your head. Finally, we have the tendons and ligaments. Tendons, strong cords that connect muscles to bones, allow for smooth and controlled movements. Ligaments, tough bands of tissue that connect bone to bone, provide stability and prevent your shoulder from moving too far in any direction. Now that you have a better understanding of the key players, let's talk about how they work together to create the incredible range of motion your shoulder possesses. Your shoulder is a ball and socket joint, which means the rounded head of your humerus fits into a shallow socket in your scapula. This unique design allows for an impressive range of movements, making your shoulder the most mobile joint in your body. You can move your arm forward and backward, up and down, and even rotate it in a full circle. Let's break down these movements into their technical terms. Abduction, lifting your arm away from your body. Think of reaching for a high shelf or waving hello. Adduction, bringing your arm back towards your body. Imagine giving someone a hug or reaching across your chest. Flexion, raising your arm forward and upward. Picture reaching for the sky or doing a bicep curl. Extension, moving your arm backward, like when you're throwing a ball or reaching behind you. Rotation, turning your arm inward, internal rotation, and outward, external rotation. Think of turning a doorknob or scratching your back. While your shoulders are incredibly resilient, their flexibility comes at a price. The wide range of motion makes them susceptible to various injuries, especially with repetitive use, overuse, or sudden impact. One of the most common shoulder injuries is a rotator cuff tear. Remember that group of small but mighty muscles we talked about earlier? Well, overuse, repetitive motions, or a sudden injury can cause tears in these muscles or their tendons. This can cause pain, weakness, and difficulty with everyday movements like reaching or lifting. Another frequent offender is shoulder impingement. This occurs when the tendons of the rotator cuff muscles become compressed or irritated as they pass through the narrow space beneath the acromion, a bony projection of your shoulder blade. Impingement can cause pain, especially when lifting your arm overhead, and may lead to bursitis or tendinitis. Section 5. Protecting your powerhouse. Tips for prevention. The good news is that many shoulder injuries can be prevented by taking proactive steps to protect these vital joints. Here are a few key tips to keep your shoulders healthy and strong. Never jump into strenuous activity without warming up your muscles. Simple arm circles, shoulder shrugs, and crossbody arm stretches can help prepare your shoulders for action. Whether you're lifting weights, playing sports, or carrying heavy objects, using proper form is crucial. Maintain good posture, engage your core, and avoid jerking or sudden movements that can strain your shoulders. Avoid overuse and repetitive motions. If you engage in activities that put repetitive stress on your shoulders, be sure to take breaks, listen to your body, and gradually increase the intensity and duration of your workouts. Strong shoulder muscles provide stability and support, reducing the risk of injury. We'll dive into specific exercises in the next section. Section 6. Strong and stable. Exercises for a healthy shoulder. Ready to build some shoulder strength? Here are a few simple but effective exercises you can do at home or at the gym. Stand facing a wall with your feet shoulder width apart. Place your forearms on the wall, elbows bent at a 90-degree angle. Slowly slide your body down towards the wall, keeping your back straight and core engaged. Hold for a few seconds, then push back up to the starting position. Stand with your feet shoulder width apart, holding a light dumbbell in each hand. Bend your elbows to 90 degrees, keeping your upper arms close to your sides. Slowly rotate your forearms outward, away from your body. Pause, then slowly return to the starting position. Stand with your feet shoulder width apart, holding a light dumbbell in each hand. With your elbows slightly bent, slowly raise your arms out to the sides until your elbows are about shoulder height. Pause, then slowly lower the weights back to the starting position. Section 7. Beyond strength flexibility for long-term health. While strength is important, don't overlook the importance of flexibility. Stretching regularly can help maintain your shoulder's range of motion, prevent stiffness, and reduce your risk of injury. Here are a few stretches to incorporate into your routine. Gently pull one arm across your body, holding it just above your elbow with your opposite hand. Hold for 30 seconds, then switch sides. Reach one arm overhead and drop your forearm behind you, resting it on your back between your shoulder blades. With your other hand, grasp your elbow and gently pull until you feel a stretch in your shoulder and the back of your arm. Hold for 30 seconds, then switch sides. Stand in a doorway with your arms at shoulder height, placing your forearms on the door frame. Lean forward slightly until you feel a stretch in your chest and shoulders. Hold for 30 seconds. Posture power. Stand tall for happy shoulders. Believe it or not, your posture plays a significant role in your shoulder health. Slouching or hunching over can put extra stress on your shoulders, leading to pain, stiffness, and even headaches. Make a conscious effort to maintain good posture throughout the day. Stand tall. Imagine a string attached to the top of your head, gently pulling you upwards. Keep your shoulders relaxed and pulled slightly back, your chest open, and your core engaged. Sit up straight, choose a supportive chair and avoid slouching. Keep your feet flat on the floor, your shoulders relaxed, and your head level. Be mindful of your phone. We're all guilty of it, craning our necks to look at our phones. Try holding your phone at eye level or taking frequent breaks to avoid neck and shoulder strain. Listen to your body, early signs and when to seek help. Your body has an amazing way of communicating with you. Paying attention to any aches, pains, or limitations in your shoulder movement is crucial for catching problems early on. If you experience sudden, severe pain, significant swelling, or a popping sound followed by intense pain, seek medical attention immediately. These could be signs of a serious injury. For persistent pain or discomfort, don't ignore the signs. Consult with your doctor or a qualified healthcare professional. They can help determine the cause of your pain and recommend the best course of treatment, whether it's physical therapy, medication, or other interventions. Your shoulders, your freedom. A recap. Your shoulders are your gateway to a world of movement. Understanding their intricate anatomy, recognizing the importance of strength and flexibility, practicing proper form, and listening to your body are the keys to maintaining healthy, happy shoulders for years to come. Remember, prevention is key. By incorporating the tips and exercises we've discussed today into your routine, you can keep your shoulders strong, mobile, and pain-free, allowing you to continue doing all the things you love. Coming soon, unlocking the secrets of your... Thank you for joining me on this journey into the incredible world of your shoulders. Stay tuned for the next episode of Know Your Body, where we'll be unlocking the secrets of another amazing part of your anatomy, your knees. We'll explore their complex structure, common injuries, and practical tips for keeping them healthy and strong. See you next time.